I would like to present myself, Amira Osama Ibrahim from Biochemistry Department, Faculty of Pharmacy, Tanta University. My research article title is Attenuation of Hepatic Fibrosis by a combination of Losartan and Atorvastatin in experimental modeling rates. An introduction for my thesis is that fibrosis is a versatile wound healing response to either acute or chronic stimuli, including alcohol abuse, hepatitis, or metabolic disorders. To date, there is no effective therapy for hepatic fibrosis, despite the fact that chronic liver diseases affect hundreds of millions of people. Once fibrogenesis occurs, it progresses to cirrhosis and ultimately develops the increased risk of hepatocellular carcinoma. Hepatic fibrogenesis includes hepatocellular damage associated with inflammation and continuous tissue remodeling. As a result of this process, there is a progressive accumulation of extracellular matrix in the parenchyma, which distorts the normal architecture of the liver and causing the formation of fibrous scar. These inflammatory reactions activate a special type in the subendothelial space, which calls the hepatic stellate cells, or abbreviated as HSC. The activation of these hepatic stellate cells, which present in the normal liver, as shown in this diagram in orange color, in a quiescent state, after following liver injury, it becomes activated into a myofibroblast-like phenotype and producing excessive production of extracellular matrix proteins and formation of a fibrous scar. The hepatocytes lose its microvilli and loss of fenestration in the endothelial cells, and the contraction of the hepatic stellate cells cause the increased resistance to blood flow and causing the portal hypertension. The activation of hepatic stellate cells, as we said before, by various fibrogenic mediators upon the activation of hepatic stellate cells, causing the increase of extracellular matrix. One of the most important extracellular matrix is hyaluronic acid, which is now the sensitive diagnostic marker for detection of the development of liver fibrosis. And then it leads to cirrhosis, which is the end-stage consequence of fibrosis, and ultimately the hepatocellular carcinoma. In this study, we used Losartan, which is an angiotensin receptor blocker. Renin-angiotensin system plays a major role in the progression of liver fibrosis. The key components of the RAS, like angiotensin 2, is produced de novo by the activated hepatic cells upon activation and following liver injury. So in some animal studies, the lack of angiotensin receptor type 1 or administration of ACE inhibitors or angiotensin receptor blockers attenuated the progression of the liver fibrosis. Statins, we used also in this study Atorvastatin, which is one of the statins, the lipid-lowering drugs. The statins are known to have pleiotropic effects independent of their cholesterol-lowering properties. The potential use of a statin as antifibrotic agent is based on their ability to decrease the growth of human hepatic stellate cells, which is the main effector cells in fibrogenic reaction. Aim of this study to investigate the effect of AT1 receptor blocker, which is Losartan, and Atorvastatin, either as monotherapy or a combined therapy, and to compare using them as monotherapy or combined therapy on the development and progression of liver fibrosis induced by carbon tetrachloride CCl4 in a rat model. This study included about 70 adult male albino rats, and hepatic fibrosis was induced by IP injection of 50% CCl4 twice a week for 8 weeks. Rats are then subdivided into 4 subgroups: fibrosis control group, which continued the IP injections of CCl4 for further 4 weeks, and 3 drug-treated groups: Losartan with Atorvastatin, or the co-treated group, which given the assigned treatment daily for the further 4 weeks along with the injection of CCl4. The doses for Losartan is 10 mg per kilogram orally, Atorvastatin 10 mg per kilogram orally, and the co-treated is a combination of both drugs. A 5th group of 10 rats served as normal control and received the vehicle. The measured parameters in this study is serum ALT and AST activity, which measured spectrophotometrically using a diagnostic kit. Serum level of hyaluronic acid was measured by enzyme-linked immunosorbent assay, ELISA. Hepatic collagen content measured as hydroxyproline was measured chemically, and histopathological examination of liver tissue by H&E. The result, as shown in this table, ALT activity and AST activity was significantly increased in fibrosis control group. And the 3 drug-treated groups were significantly decreased ALT activity and AST activity compared to fibrosis control, with the greatest decrease in the co-treated group. Also, the co-treated group decreased ALT activity significantly compared to Losartan, either the administration of either drugs alone. Serum hyaluronic acid, and as I said before, serum hyaluronic acid is an important extracellular matrix protein which increased in the liver fibrosis. Here in fibrosis, as shown in this figure, fibrosis control group showed a significant increase, 4-fold the level in normal control, while the 3 drug-treated groups significantly decreases compared to fibrosis control, with the greatest decrease in the co-treated group. Hepatic hydroxyproline content, which is a specific biochemical marker for quantifying fibrosis and evaluating the effectiveness of new antifibrotic therapies. As shown in this figure, fibrosis control significantly increased hepatic hydroxyproline content compared to normal control, and also the 3 drug-treated groups decreased hepatic hydroxyproline content, but as shown in the figure, only the co-treated group reduced the hepatic hydroxyproline content nearly to the range in normal control group. There is correlation between the measured parameters, hydroxyproline content and ALT and AST, significant positive correlation between the measured parameters. Histopathological findings. In the first figure, figure 3, is a liver section from normal control. We used ISHAQ classification for the classification of fibrosis and cirrhosis. In the first figure is a normal control, grade 0, with the absence of inflammatory reaction. In the other figure, figure 4, is a liver section from fibrosis control group showing grade 2, which means early fibrosis with portal tract bridging and severe inflammatory reaction. In the next slide, severe inflammatory reaction around the bile duct in fibrosis control group. Figure 6 is a liver section from Losartan treated group, and figure 7 is liver section from Atorvastatin treated group, which shows mild portal fibrosis score grade 1 with mild inflammatory cell infiltrate. Figure 8 is a liver section from rats from the co-treated group showing apparently normal liver with no fibrotic changes, grade 0, which is nearly the same as normal control with mild inflammatory reaction. As shown, it is a model of early fibrosis since it is grade 2 with severe inflammatory reaction associated with significant elevation of ALT, AST, and hyaluronic acid. The monotherapy reduced the hepatic scores of hepatic fibrosis from grade 2 to grade 1 and the inflammatory reaction. Serum HA levels indicate endothelial and sinusoidal cell dysfunction associated with fibrosis progression and considered as a sensitive marker and diagnostic tool for hepatic fibrosis, which is also significantly increased 4-folds in fibrosis control group. As we said, determination of hydroxyproline is regarded a good method to quantify fibrosis and is also significantly increased in fibrosis control. Regression of fibrosis in monotherapy with Ator or Losartan groups reduced the grading to grade 2 and reduced other markers. In our study, there are few studies investigated the combined effect of AT1 blockers and statin in vitro. Meanwhile, our study represents a new addition to examine the combined effect of Losartan and Atorvastatin in vivo in CCL4 intoxicated rat. Also, compared to the use of either drugs as monotherapy, the co-treated groups showed preserved hepatic parenchyma with no apparent hepatocyte damage and less infiltration of inflammatory reaction, which indicate amelioration of hepatic fibrosis progression. This proves that this Losartan Atorvastatin combined treatment induced further inhibition of fibrogenesis and protected the liver against CCL4 chronic liver injury. As known, many factors are involved in the development of liver fibrogenesis. The combination therapy of agents with different mechanisms would be better than a single agent only. Also, they were achieved at clinically comparable low doses, and further investigation are required to examine the antifibrotic effect of this combined drug with using other fibrosis model. Thank you.